Next we come to pure tone audiometry, that is audio block. So it's coming. Test PTA pure tone audiometry. It checks for the speech frequencies. What does it do? Obviously, type of hearing loss, degree of hearing loss, and affected frequencies. It measures all of this. Okay. So normal range of hearing. What is this? It is range of hearing. If I see right here, normal range of hearing is -10 to 25 decibel. Okay, it is better. It is up to this. We check here, -10 to 25 decibel. Now comes to the next part, that how much hearing loss is present in any case. Okay, for example, if this is my ear, external ear, it is my tympanic membrane. So any kind of obstruction in here, in the external auditory canal, any kind of obstruction, it will cause a hearing loss of 40 decibel. Okay, in case of tympanic membrane perforated, that means it is perforated by any case, it will cause up to level of perforation, it is maximum up to 40 decibel, 10 to 40, tympanic membrane 10 to 40. Also, tympanic membrane perforated along with ossicular discontinuation, that means this and this is discontinued, that will also cause 40 decibel. This is my middle ear entirely, 40 decibel. If in tympanic membrane intact but ossicular discontinuation occurs, then it will cause more severe. This means it is not here and it is also not here, but it is here but it is not here. It will cause 55 decibel loss. And obviously complete fixation of foot plate of stapes, this become here. This will alone cause the most 60 decibel hearing loss. Okay. This is the hearing loss. Foot plate of stapes if fixed, that means in osteosclerosis. Okay. Next comes, these are just not so important. If more than 70 decibel hearing loss is occurred, that means in my this, if more than 70 plus hearing loss happens, then cochlear implant must be free. Cochlear implant. Okay. So let's come to the hearing loss levels, grading of hearing loss. So we have a range of hearing loss skills. There is a scale. Okay, let's come to this part. If we just simply check this grade the hearing loss levels, you can see. So for from 0 to 25, these actually not from 0, we will consider from -10, and 0 and 25 it is normal. Next comes 26 to 40, that means just 15 more. Just simple 15 jump, that is up to 40 decibel. It is mild hearing loss. Then more 15, that is up to 55. It is simple moderate, and then more 15, that is up to 70. It is moderately severe, and more 70 to 90. It is severe. Above that, anything, it is profound. So where we are actually implanting the cochlear implant, that is more than 70, that means in here cochlear more than 70 means here cochlear implant in this area, that means in this plaque area more than 70, we will use cochlear implant. This is simply ASHA classification, that is American Speech and Hearing Association. It is ASHA, American Speech and Hearing Association. ASHA is here in this range we will use cochlear implant. If we see the WHO classification, then it is simply just like this: mild, here moderate comes a little bit more, 20 positive, that means moderate, and just 20 to 80 severe. Then over 80 is profound. So nothing very much different, but not writing it here. Let's come to the interpretation of the audiogram. Okay, anything in the PTA, pure tone audiometry, anything in red is actually right. Right is red right. If it is simple circle, that means air conduction unmask, no masking. Unmask. Okay, if it is like this, then air conduction mask. If it is like this, opening to right side, okay, so it is bone conduction unmask. It is like this, opening again in the right direction, so bone conduction of right ear mask. If it is left, then it will be in blue color. Left, that is balm side, that is blue. So air conduction unmasked will be like this. Air conduction masked will be like this. Air conduction, bone conduction unmasked will be like this, and bone conduction masked will be like this. In the left side, we will open in the left side. These are the simple signatures. Now we need to simple differentiate between things. Here comes an important thing, that air conduction. Air conduction, it means what? It means that conductive hearing plus sensory neural hearing, while the bone conduction means only sensory neural hearing. Is an important thing. What does means this mask or unmasked? Mask means the opposite. Masking means opposite ear white noise, in opposite ear white noise played. Okay, let's do the simple examples given in the book. I'm repeating, I will obviously make another video on simply the questions from different books, standards. Okay, so what is here? We are seeing red circle, that means in the right ear conduction, and red this sign obviously working in the right side. It is up to 25 years, over 20 above 25, so it is normal. Here also from 0 to 25, it is not crossing 25, so it is also normal air conduction. If the bone conduction is not given, then obviously we'll think that bone conduction is normal. Next, here if we simply focus on any single line, that red circle, obviously it is right ear conduction, it is not crossing 25 mark, that means it is normal. And the blue cross, it is also not crossing the 25 mark, that means both ears are simply normal. Okay, in this case, if we see it is a black colored, so we have to simply rely on the signs of the case. So in black color we are seeing that right circle here, right circles, that means round right circles, round is right ear conduction, it is up to 50-60. Okay, so in this case we are saying that here is a hearing loss. Will have then two options, one is conductive, one is sensory neural hearing loss. But the bone conduction in this case is simply not crossing 25 decimal marks, so sensory neural hearing loss is not the option. The answer is conductive hearing loss. So conductive deafness is present in this case. So which level of conductive deafness is here? So we will find the speech frequencies, that is 500, 1000 and 2000. 500 means here around, I can say it is 40 decibels, I guess. It is also 40 decibels, and it is 2000, it is around, I can roughly say 50 decibels. So the level of conductive hearing loss is 40 plus 40 plus 50 divided by 3. So it is what? It is simply, we have 44, 100, 150, 148. Come on here. 130 by 3 something 43 decibels. That means it is in the mild moderate hearing loss level. Okay, next comes here. Here we are finding that it is beyond 25 obviously, and here it is right. So round right ear conduction loss. That means we have two options: conductive plus sensory neural hearing loss. And the bone conduction, that is also in the right and unmasked, it is also following this pattern. So it means the bone conduction is also following this pattern. That means it is sensory neural hearing loss is happening in this case. Okay, if the gap AB gap, that means air conduction and bone conduction gap, is less than 15, then it is obviously uh, will say it is the same curve. Okay, okay, in the next case, if we have this slope, obviously it is beyond 25 decibels and it is cos means it is left AC ear conduction is not doing properly. Now we can see the bone conduction graph. It is left side, obviously it is the left side and it is beyond 25. Here it is 25, mostly it is beyond 25. So bone conduction is obviously this is bone conduction is not occurring properly and these two are not following each other. Okay, gap is more than 15 decibel. So here the left bone conduction is problem and left ear conduction is also having problem. So in this case it is a mixed hearing loss. Mixed, why mixed? Because in this case we see that bone conduction, it is obviously not occurring properly along with air conduction, but this air conduction here also bone conduction is already incorporated, but these two are not following each other. Okay, in this scenario we see that these two are actually following each other. That means this air conduction problem is actually lying in the bone conduction, that means sensory neural hearing loss. But in this case here we see air conduction is happening since conductive sensory neural hearing loss both, and here sensory neural is hearing loss is present. It is present, so it is present, but it is also present. So it is a mixed hearing. Okay. So let's watch this one. This one is nothing same, like it is very simple. So in this case just trace a single line in any case. So at first we see the round right. So I'm writing here in this case as well the round right. It is obviously hearing loss is there, and that means air conduction is not occurring. That means conductive plus sensory neuron season both are occurring in the right ear. Here it is 25 decibel and the bone conduction of the right ear, that means this one, it is quite normal. So bone conduction is alright. From here bone conduction is alright means sensory neural hearing loss is not occurring. Sensory neural is, it is alright. So problem is in this one. So conductive hearing loss, right sagittal along with left we see in this case cross left. Problem is there air conduction, that means obviously Ca plus Sn both Here also bone conduction is normal. Bone conduction is normal. So bone conduction, it is bone conduction obviously, not AC. Bone conduction is normal means SNHL is not occurring, means sensorineural is normal. So this part is normal. Problem lies in the sensorineural hearing loss. So left CHL. Okay, and the difference between these two are obviously more than 15 decibels. So obviously it is conductive hearing loss. Okay. In both cases. This one is a previous year question. So if I see round right, air conduction means problem in here. So there is two components, CH conductive and sensorineural part. And if we see the bone conduction, if there is no bone conduction given or the right, means no BC is given, so it is normal. If no BC is given, then BC normal means that implies that sensorineural is normal as well. BC normal means SM is normal, so it is normal. So problem lies in the sensorineural CHL. So right CHL, and in it is the left, cross is the left one, left air conduction, and it is in the normal range. It is air conduction is normal means both C plus SM, everything is normal. So it is only right hearing loss. Okay, say so, right, say so. The P by 2 answer. Next. Okay, these are a little bit tricky. Okay, in this case, if we trace it, we see obviously it is 25 decibels. That means this one, it is 20, it is 30. So that means this part. So in the 25 decibel part, if we see that 500, 1000 and 2000, only 500 and 1000 are in the normal range. Okay, but in high frequency, that is 2000, 4000 or 8000, we are seeing a hearing loss in both ears. Okay, both ears, ear conduction, that means CHL plus SNHL. So it is the right one, right. 0 means conductive plus SNHL, and it is also followed by this one. Okay, so it is followed by this one. That means it implies that bone conduction is not occurring. Bone conduction, that means answer is this, hearing loss. It is normal, it is problematic. Listen. So at high frequency, right sensorineural hearing loss is occurring. If we see the left case, it is the left one. In the left scenario, we have the same thing. At right sensorineural hearing loss is occurring at high frequencies, so it is called bilateral high frequency SNHF. It is a downsloping audiogram seen in ototoxicity noise trauma, that is caused by musicians, and presbycusis for old persons. Presbyopia, just like that, it is presbycusis. Next one is the low frequency sensorineural hearing loss. Okay. If we see in this case, we see the right one, it is quite normal. In this particular scenario, it can happen in any year. In this particular scenario, we see the right one is normal within 25. It is the 25, so it is right one is absolutely normal. Right here, normal. But in the left ear is normal in this part, but here in the low frequencies 250, 500, 1000, we see a hearing loss, and this hearing loss is accompanied by also its bone conduction. That means it is sensorineural hearing loss. So left This means both C plus Sn. Now this one along with it opening in the left side, it means, it implies that it is sensory neural hearing loss, not conductive bone. So it is happens at low frequencies. So low frequency sensory neural hearing loss, where seen it is in Maynard's disease. Okay. It is simply written in here. Okay. Downsloping, we have seen noise induced hearing loss in case of musicians like me. Since ototoxicity and presbycusis means old person. Upsloping in Maynard's hearing loss. If a dip is seen, that is noise at 4000, it is noise induced hearing loss, like this one. In this case, bilateral SNHL with acoustic dip, that means everything is normal, it is the normal range 25 decibel, everything is normal in 500, 1000, 2000, everything is normal in speech frequency, but at higher frequency like 4000, especially in 4000, we are seeing a dip. This is called acoustic dip. First change in noise is induced hearing loss, NIHL. Okay. In later stages, this will also come down and it will make a downsloping audiogram. That is simply written in here. So 4000. Next is the U-shaped cookie bite. Mid frequency hearing loss in congenital SNH, congenital by birth. Same here, just like 4000 is in an acoustic dip in noise induced hearing loss in IHL. Same like that, we see a dip in 2000 in case of otosclerosis, means stapes footplate gets fixed. Stapes footplate get fixed. Okay, here see 2000 and it is a bone, so it happens in the bone conduction. Okay, it is called Cahard's notch. Okay, these two are questions. And obviously there is overall AB gap is present in this case. Okay, in this case AB gap is absent, in this case AB gap is present. So that's the trend. Okay, let's just write parts from his PTA, pure tone audiometry, PTA findings. Downsloping one. That is high frequency hearing loss. It happens when in high frequency, that is noise induced It is increasing. Screamers. Frequency. Running loss. Congenital. Snitch. CNN. PC 2K.